Hi, I'm Dr. Sasha McBain, clinical psychologist and member of the ISTSS Public Information and Education Production Subcommittee. ISTSS strives to disseminate knowledge and promote high-quality education and training to improve access to care and quality of care for those who are impacted by traumatic stress. To meet this objective, the ISTSS Production Subcommittee is collaborating with developers of the interventions highlighted in the ISTSS Prevention and Early Treatment Clinical Guidelines to support widespread dissemination and implementation of the recommended interventions among ISTSS members and the broader public. Today, I'd like to welcome Dr. Arnold van Emmerik, the developer of structured writing therapy, which was recommended as an early intervention with emerging evidence. Thank you for being here.
Thank you for inviting me.
Yes.
Yeah.
So I'd love to start with, you could just give us a brief introduction, tell us a little bit more about you and your current position.
Yeah, well, I'm in the University of Amsterdam in the clinical psychology department, where I do research and teaching. Quite a while ago, I completed my PhD in based on a large randomized controlled trial that compared this writing therapy or structured writing therapy to cognitive behavioral therapy. And this is when I got involved in trauma treatment and writing therapy specifically.
Tell us a little bit more about writing therapy or some of the specific goals or key components of the intervention.
Yes, well, of course, the specific goal is reducing post-traumatic stress disorder or post-traumatic stress symptoms. And we've also seen in most studies that there's also a positive effect on comorbid depressive symptoms secondary to PTSD. So that's obviously the main goal. And this structured writing therapy, the model, it has three main components. It's the first component is called imaginary exposure, or it's actually in a way, a conventional imaginal exposure component that follows typical instructions like exposing yourself to the memories in the present tense, first person, etc. Except the only difference is do it in writing. So, but it's basically imaginal exposure. And then after that, the second component is focusing on cognitions and coping with the traumatic memories. And so the writing assignments in that second phase are focusing on that. And the third component is a social sharing component, in which patients write a letter to an imaginary friend that has experienced the same traumatic event. And this is intended to facilitate social support, which we know is, of course, a predictor of PTSD.
That's really interesting. Yeah, the social component is really interesting. And I think that it kind of reminds me a little bit of like cognitive diffusion from acceptance and commitment therapy, where you're kind of getting your own experience outside of yourself and writing it, as if it was, not your experience. I think that's an interesting concept.
Yeah, although I never thought of what you're saying now, but I would associate that more with the second component, actually, because if I can elaborate on that a bit.
Yeah.
The first writing assignment actually is, in that second component, is to write an advice to this, advice to an imaginary friend where they think that this person has experienced the same event as the patient and the same experiences, etc. I must correct myself, because the third phase is not an imaginary friend, the letter writing. It's to a true person, and you decide if you send the letter or not. So, but the first assignment in the second phase is intended to sort of step out of the experience and advise somebody else, because we're all very good at that, to give advice to somebody else. And it's more difficult to do it yourself. And then to generalize this advice to yourself. Yeah.
Mm-hmm. Yeah, that's interesting. Is there a specific target population for the intervention or specific types of trauma that you've seen this work best with?
No, actually not. It's basically it's PTSD patients, and we did do a prediction study once, and we found no indications that it would be particularly suitable for type 1 or type 2 trauma, or people with different ethnic or cultural backgrounds, etc. There was no indications for that. Yeah, and I think it is, in a practical way, it is more suitable because it's very suitable to do online. So if you think of particular target populations, so people who are in remote areas or have practical difficulty attending face-to-face sessions during office hours, for instance, it might be convenient for those people in particular, perhaps.
Yeah, it might help increase access to evidence-based PTSD care, which is especially relevant right now, has always been relevant, but feels especially relevant. How do you measure treatment outcomes to determine that the intervention is having its desired impact on individuals?
Well, my own experience is, of course, in research trials, and there we use the widely used structured interviews, for instance, the SCIP interview to evaluate PTSD, and well-known self-report questionnaires such as IES or PDS or what have you.
Okay.
Yeah.
How do you
BDI for comorbid depressive symptoms, for instance?
Okay.
Yeah.
How do you ensure that the intervention is culturally sensitive for diverse populations?
Well, yeah, this is one question I had to think about a lot, because actually to be honest, we didn't really think about it, because we found no indications that it is particularly suitable or unsuitable for specific subpopulations or diverse populations.
Mm-hmm.
The instructions and the feedback, they are quite, well, cognitive behavioral in nature. Like, for instance, in the second component, the cognition and coping, the therapist is really focusing on what are sort of dysfunctional or unrealistic thoughts that the patient may turn out to have from the writing assignments. Mm-hmm. So it's, of course, there's room to bring in whatever is useful to a patient. But it's also quite conventional in a cognitive behavioral sense.
Mm-hmm. Yeah. Mm-hmm. That makes sense.
Yeah.
Can you speak to what resources and training are required to implement the intervention?
Yeah, there's not a very specific thing, I think, but I would recommend, well, a conventional professional training in clinical psychology or psychiatry, and some, well, you would have to be comfortable and knowledgeable about general CBT theory and treatments, because it's basically, I think it's a CBT treatment done in writing, but the principles are well, cognitive behavioral in nature.
Okay, thank you.
So conventional training in CBT, clinical psychology, psychiatry, etc., and perhaps some specific training in the writing model and how to give instructions, etc. Mm-hmm. That will do.
When you've seen this when you've done this in the context of research studies, you know, there's things that you're naturally doing to kind of get the intervention implemented. In terms of, if you were to kind of think about like financial resources needed to get an intervention like this up and running, would it be similar to maybe, like you were saying, other traditional CBT interventions?
Yeah, well, except perhaps the model that we studied and that most other studies also focused on is quite brief. It's five weekly sessions, and patients write in between those sessions. So I guess you could say that it would be relatively cheap compared to other therapies, except perhaps EMDR. But I mean, even CBT is usually longer than 5 sessions, I would say, in general.
Okay, thank you.
Yeah.
Do you have any thoughts about what considerations are necessary to ensure the sustainability of an intervention? Like what would need to be in place for this to be viable outside of a research context?
Nothing special needs to be done. I mean, except for training, because you could easily substitute it for a CBT, for instance, or for conventional CBT or EMDR or other PTSD treatments. If only the therapist is trained well enough in this specific writing therapy, then it can be quite easily implemented and sustained in a clinical setting, outside of research. Yeah.
Have you seen that people need your therapists or those administering the treatment? Have you seen them needing kind of continued consultation around the intervention, or is it kind of you get the training, you get people who have the background in PTSD treatment and they can kind of adopt this intervention, or are they needing kind of more consultation to?
Not more than any other therapy, I would say. It's actually my clinical impression is that from the studies that I've been involved in, that it's quite an acceptable, it's well accepted by patients and therapists alike, this intervention. I think it's the nice thing is that you have these writing assignments and you can read them back, and you can have colleagues read them, and you can take your time to comment on it. But it's not that it needs more supervision or intervention than other therapies, I think.
Okay.
Yeah.
What challenges and lessons have you learned from implementing the intervention, or any advice you have for people who might want to be doing either clinical work or research around structured writing therapy?
Well, I would encourage any research, further studies on writing therapy, because I think it's an effective therapy. There's a growing evidence base, and it's in a way, it's a nice intervention to do, I think, for therapists. If I have read these writing assignments, I always felt very privileged in a way that I could read these very intimate accounts of the traumatic experience. So I would say, give it a try, get yourself trained, and get going.
Yeah. Do you have any guidance on where people can seek out additional training?
I'm not aware of any, let's say, continuous opportunities to do this. I now and then I do a workshop myself on conferences or other occasions. But there are no training institutes or courses, as far as I know, in the Netherlands. And I'm not sure in the United States, about the United States.
Maybe this is our opportunity to recruit somebody who's passionate about it, who can get some training going.
I'll look for a person like that. Yeah.
Have there been any changes to the way the treatment is conducted or implemented since its initial development?
No, not really, I think. Like I said, it's not widely implemented in the Netherlands. Unfortunately, I think. So I'm not aware of any developments in the field regarding implementation.
Yeah. What do you think has kept the intervention from being more widely used in the Netherlands?
That's an interesting point. I don't know. I mean, here CBT, specifically exposure, and EMDR have been, of course, first-line treatments, rightly so, I think. And last year there has been an update of a Dutch treatment guideline, and it's sort of, along with a few other therapies, writing therapy became sort of promoted to a first-line treatment as well, although still secondary to exposure and EMDR, but it's, well, so I hope this helps to get it implemented more rightly. So I think, honestly, I think CBT or exposure and EMDR are rightly first-line treatments still. I mean, the evidence base for those interventions is much larger. So my recommendation would be to start with those treatments first.
Yeah, that makes sense. My final question for you, we can't get away without talking about COVID, and just wondering if you have any general thoughts about this intervention in the context of COVID, or any opportunities, any challenges that have come up, just any reflections on using structured writing therapy within our current context.
Yeah, well, I think writing therapy, because it can be done online, is excellent for settings in which COVID restrictions apply. If you can't meet face to face, but you can meet online, or you can send writing assignments and instructions and feedback online, it's very suitable, I would say.
Yeah. Great. Again, kind of coming back to potentially increasing access and, being able to provide a service even when people aren't able to come in person for treatment.
Yeah, right. Yeah.
Great. Well, thank you so much. Is there anything else that you want to make sure that we talk about when it comes to structured writing therapy before we end?
No, nothing. Well, I think it sort of comes back to your question why it is not widely implemented. I have some sort of feeling that writing is more difficult or somewhat stranger to patients than for instance, CBT. And I think actually this is a misconception, because writing is more familiar to most people than we think. How many people already write? They write diaries, they write books, letters, etc. So writing about traumatic or other experiences quite familiar to most people already, and it's in a way it's less strange than EMDR or doing conventional exposure or completing thought registration forms, for instance. So I think the step to writing for patients is smaller than most therapists would think.
Yeah, that makes sense. And I think too that some of the experiences that people go through, with a trauma can literally feel unspeakable, and so if there's a way for people to be able to process their experience, and not have to immediately think of the right words, or, the opportunity of writing to kind of really sit and reflect and be able to get it out, I think is a different process, and I think it is really valuable. Yeah.
What I do if I have something on my mind and it stays on my mind, I write it down. I mean, it's not about traumatic experiences, but things that sometimes worry you or that you're stressed about, and I wake up in the night and then I write it in a book. So this is not trauma writing, but it sort of shows the familiarity also of writing, I think.
Yeah, absolutely. Thank you so much again for being here. Really appreciate it. And we'll end there.
Yeah, thank you.